I'm Jenny, I'm 52 and my goal is to get back to work.
My name's Simon, I'm 42 and I want to see my boys grow up.
My name is Deirdre, I'm 56 years old and my goal is to be an inspiration to someone out there.
It's a really difficult time. You get told you've got cancer, but they have to do further testing to work out what stage you are and what type you've got. So you've got all these questions you can't get answered. So it's really quite emotionally difficult. So it took a while to have your biopsy and all your scans, and then you get your diagnosis, and then you can have your questions answered. So I suppose that's the hardest thing I found was not knowing. It was good. My haematologist gave me a book, 101 questions and answers about lymphoma, which was really great because it told you all about lymphomas and the types and a little bit about treatments and stuff. I went online looking for it because it's uncommon, there's not actually a lot of information out there about it. But everything was quite positive that it was quite treatable and had a very good cure rate. So it just eases your mind a bit as you read things like that. And because when the doctors tell you the stuff in the rooms, you're still in a bit of shock, so you don't remember it all, and having that written information to go back to sort of reinforce that was really quite comforting.
I knew something was going wrong with me because the lumps were just coming up behind my ear. I had one here just at the base of my neck and then a tiny one on my abdomen. And I was a bit scared and worried, but the moment I knew that it was non-Hodgkin's or the least of all cancers, that's what my hematologist told me, and the medical science that's out there could cure it, and the treatment that I was offered made me feel very confident, and I had no doubt what they were doing with me, and I just trusted my specialists. Honestly, I was not shocked because 1.5 months, seeing the GP and knowing that it was cancer and that I was in the right hands and I was going to do chemotherapy, it was a great sign of relief.
So I actually had bad stomach cramps and was unable to hold down food, and I went to see the GP and we were of the impression that it was basically just gastro. So that got worse, and I went on antibiotics and then saw some improvement. But over a period of about 2-3 weeks after that, I was feeling pretty bad and run down. Eventually I went to the Austin and I was there for 11 hours before the word cancer was actually used. But basically they did a scan of me. We were working on the basis that we wanted to find out what was wrong with me. So they did a scan and it looked to them like a very advanced form of stomach or bowel cancer. I had tumours throughout my sort of lower stomach and sort of in the chest, sort of up near the heart. So obviously that was fairly devastating. It was a bit surreal when it actually happened. I was having 2 small children. My wife was at home with them.
You want to know, is it going to kill you? Are you going to see your kids grow up? What's the treatment going to be like? But your first question is, am I going to die? And when you're first told, you don't know. And that as I said, was quite traumatic. And even though, I'm a doctor, it's still different being on the other side of the fence, and you've got to put yourself into your doctor's hands and give them control over your treatment and, not quite your destiny, but your destiny. With my stage being stage 3, chemo was the only treatment option that I was given, so I just went along with that. You have to choose whether you go private or public. I had private cover, the hospital was closer to home and I had no extra payment, so I went private. I was also already going to that same hospital having immunoglobulin infusions for my pre-diagnosed immunodeficiency. So it was comfortable for me. I knew the hospital, I knew the staff already, so it was probably less scary for me to start my treatment there.
I haven't had a major hospital stay in my life before that. So there was a lot of new experiences very quickly, which in some ways I wasn't prepared for. But at the same time, there was a lot that I didn't know, and I think that actually helped me more than knowing the ins and outs of what I could be facing. And so, I mean, any questions I had, I'd be asking the doctors or the nurses. I wouldn't be relying on Dr. Google. My wife did quite a bit of that and quite a bit of research, which I think was both a positive and a negative. I mean, there's only so much that you can find out about what you could be facing. I mean, it turned out that I had a pretty severe diagnosis, but at the same time as one of the most treatable.
When you're going to have your treatment, there's a lot of the practical stuff that you have to think about. Like I was a solo GP, so we had to close the business. You worry about how you're going to look after the kids, get them to their soccer training and parties and everything else they need to go to. Going shopping, just doing all the practical stuff. But the reality of that doesn't really hit, I don't think, until you start your treatment because, everybody's side effects are different and everybody's experience is different.
I started to just document everything from day one, including all my doctor's specialist names, all my PET scans, the dates, and all the different tests that I had got done. And this journal that I had helped not only me to go back now and see how I progressed, but even times when something went wrong in between treatment and I had to be admitted in other hospitals, that helped those doctors and professionals to get a ready reckoner of what went wrong with me, and in fact they commended me for doing that.
They gave us a lot of information. They, particularly when they realised Helen wanted a lot more information, they gave her resources that she could go and look at. So we were given plenty of information. We had everything explained to us and discussed sort of what was likely to happen. But with my treatment, there was a case of, particularly in the early days, we don't have time to wait. We've got to do something now. So from my point of view, it was a no-brainer. It just, we had to go with them. In the back of my mind, I sort of thought, well, okay, we'll do it for now and see what happens. But obviously things worked pretty well for me. So the decision-making in that sense was fairly easy. Again, though, I found myself talking to the nurses a lot as well. It wasn't just the doctors. The nurses would often be able to interpret or clarify stuff that the doctors had said. I think my wife had the worst end of the stick, having to juggle the kids and me and wondering what was going to happen throughout the time I was in hospital. I mean, once we had the treatment plan worked out, we were able to settle into a routine, which involved me being at home for parts of that and being in hospital for other parts.
The first time I was diagnosed with non-Hodgkin's lymphoma, and it was August 2013. I had 6 rounds of chemotherapy from August to December, and I had a maintenance drug kind of a thing in January. And I was fine. I was doing PET scans constantly every 2 months to see how the chemotherapy was working within. And it was all going fine for 9 months when I developed a lower grade of lymphoma, which they call it follicular lymphoma. And that was the time they needed to do a biopsy of the lump, and then they decided that they will do my stem cell transplant. And that was a big, big time in my life. Although I was always maintaining that I was strong and positive, came a time when I felt that was it. And I did tell my ward, I was I was hospitalized for about 24 days, isolated, and I used to tell my ward doctors, I feel crap today. But that was how the treatment worked. 6 chemos in January. They had collected my stem cells, and prior to collecting my stem cells, they had given me an injection which helps to bring out the stem cells from the bone marrow, and that was something intriguing which I never ever experienced.
The treatment was, I think the best way to describe it was harsh. It was really hard on the body. You get told about the effects that could possibly happen, and you hope like hell they don't, but they do. I was really fatigued. I was really nauseous right through. I had pains from the treatments I had to have because my white cells went down low. And you're also trying to be positive, and I'm a single mum as well, so I'm trying to be there for the kids and trying not to show how hard it is because, you know, they're teenagers and you don't want to worry them. So it was really, really tough and, you know, quite hard to get through, but you get through it. Through my treatment, I would be writing down all my side effects and what was going on, more so when I went to the specialist that I could remember what I needed to tell him, because quite often you'd forget what you were trying to say, or you'd forget a little side effect, and I knew it was important that they know about the effects to work out whether it's still safe to continue with your treatment or not.
Basically, they started off giving me a course of R-CHOP, which is the standard cancer treatment as I understand it. That was while they were determining what they were actually going to use, which turned out to be a Codex-M and an IVAC alternating treatment. So one course of one and then one course of the next one, and then they repeated that. So there was a total of about, I think, five or six treatments that I had over a period of about 3 months.
You can't do it on your own. You have to have a support group. You know, you've got your consultant who helps get you through the treatment and the side effects and is monitoring you for, you know, psychological effects. You've got the oncology nurses and the teams down in the day oncology unit, and they're also monitoring you and talking, and we'd have a laugh down there with every treatment. And there's support people in the hospital, like the social worker came round and the psychologist came round, you know, just checking if you needed anything. You've got your family and friends that, you know, they can help out in so many ways, you know, just cooking meals for the kids so if you're tired you didn't have to and you had something in the freezer.
I was supported with a dietitian to help me to get back my weight, and yes, and I'm slowly trying to do it. It was hard because of the taste buds being damaged, but slowly I started to motivate myself, and he cooked food for me that was more palatable, and I could gain a lot of strength. Yes.
I sometimes had to give myself a stern talking to. You just got to find a way, and, you know, some days it was music, some days it was just having a sleep, some days it was going out and going for a walk. Getting out in the sunshine, you know, some days, not really going shopping because you didn't really feel like going shopping, but, you know, just getting out and about, or ringing someone, phoning someone, but just trying to be as positive as possible at a time when it's really quite difficult. And some days I failed and some days I didn't.
The very first time of cancer treatment in 2013, I had my own sick leave, 7 months of sick leave, so I was well protected. The finances were flowing in. And I had the support of my manager, an awesome, amazing woman. And went back to work, and 9 months again had to do the stem cell transplant. At that moment, I had exhausted all my leave. But I had my social worker from the hospital who advised me how and where I could get support. And one support was from Centrelink and from my superannuation.
It's funny. I mean, there were some good friends of mine, who naturally were just there, and that's sort of what mattered. There was one friend of mine who had actually had lymphoma a couple of years ago and had recovered pretty well. And I've known him since high school. And we've been pretty good friends ever since. I think it'd be fair to say that his support, it sort of added a sort of depth to our friendship, which, to be honest, we didn't really need. We were sort of still quite close, but having someone who'd had a similar experience, and he was a good person to be able to bounce off. He had a wife and 3 kids. When he went in for treatment, his youngest was, I think, 2 at the time.
I feel confident that what I've done, but there's one thing I learned during the treatment is I should have done some mindful meditation, because I'm a person that always wants to be in control of everything, never take the time to sit back and just meditate, relax. And of course, physical activity has been my downfall. So I'm trying now to get that back into my life and see how best I could have a more healthier life. Yes, it was my faith, reading scriptures, holy scriptures, my family, especially my husband, my soulmate, who is retired and who was with me day in and day out. He's been a very strong inspiration to me, my family, my colleagues, and most of all is having that confidence that whatever happens, just take it one day at a time, focus one day at a time.
I think you've got to be patient, and I think you've got to be flexible and learn to go with the flow, because things won't always go the way you want them to. Well, expect the unexpected. Things will happen that you're just going to have to adapt to. I think you have to make sure you do tell your team what's going on, what your side effects are, so that they can monitor you properly and give you the right treatments, and get help if you need it.
The support, it's been critical. You can't do this without support. You can shut down from people when you find out about this, find out about everything. Most of the big revelations for me were on my own. Helen would have been at home with the kids, or I was spending a lot of time in the hospital room on my own, and I'm okay with that. By nature, I can be fairly solitary, but something like this, you can't do it without support. It can't work. It changes your life in a lot of ways, and a lot of ways that you may not expect. And you need to be able to talk to someone. You need people who can actually help you. It's not just the physical. It's people who can sort of understand that you've been through something major. Whether it's other patients who've had treatment, whether it's just friends and family.
Cancer Council has helped me, assisted us to find a financial advisor to take care of my mortgages, the bills, and other things. I was able to access their wig service and Leukemia Foundation. They had paid one of our utility bills, gave us fuel and food vouchers, gave me transport service when I didn't have anyone to take me for my appointments. And through the survivorship at the hospital, I was invited to participate in the Look Good, Feel Better workshops. And I was their model. Didn't realize that they were going to make me up. I'm not a person who's in for all these things. I've been always very simple, but they chose me, and I was baffled at the first time. But when they did me up and showed me even how to do an eyebrow line or how to wear a scarf, that was amazing. It was so uplifting, and I really had tears of joy, actually. They even gave me a makeup kit.